Rare Disease Legislative Advocates is proud to host the 12th Annual RareVoice Awards, presented by the Every Life Foundation for Rare Diseases.
That's right, this is a celebration. Good evening, I'm Annie Kennedy, and I am proud to serve as the Chief of Policy, Advocacy, and Patient Engagement for the Every Life Foundation for Rare Diseases. Tonight, it is my honor to welcome you to the 12th Annual RareVoice Awards. What a joy, and let's clap again, it is to be together as we celebrate the extraordinary resilience and advocacy of our rare disease community, surrounded by the warmth and energy that only an in-person gathering can offer. We'd like to extend a tremendous thank you to our presenting sponsor, Sanofi. Your support and the support of all of our partners year-round is critical in so many ways. Thank you for all you do to help us amplify the voices of patients in our world of public policy. Now, it is my absolute privilege to introduce our remarkable MCs, a dynamic mother-daughter duo, Christina Casanova-Might and Victoria Might. Christina is a beacon for our advocacy community and serves as the CEO at Welcomed Co. and a board member at the Every Life Foundation. Her journey, marked by indescribable love and unwavering dedication, has been a tapestry woven with threads of advocacy, leadership, research, education, and policy. Christina's life has been profoundly touched by rare diseases. First, by her son Buddy's journey, followed by her own diagnosis. These experiences have forged in her a unique perspective and an arsenal of skills aimed at ending the diagnostic and therapeutic odyssey for patients and their families. Her daughter, Victoria, is a vibrant 12-year-old with a passion for competitive dancing, and she is a rare advocate in her own right. Victoria's spirit and creativity have been instrumental in the journey of Welcome Co., embodying a youthful perspective that champions inclusivity and accessibility. Together, they have cultivated a space where beauty and functionality converge to meet the unique needs of individuals, ensuring that everyone feels welcomed and cherished. Their story is a testament to the transformative power of love, resilience, and innovation. Here is a little more about these two incredible people.
In the heart of the rare disease community, where every challenge is met with courage and hope, there are stories that inspire and move us. Among these is the remarkable journey of Christina Casanova-Might and her family.
9-year-old Bertrand was diagnosed with something called NGLY1 recently. He was the first ever with this genetic disorder. His parents fought for years to figure out what was wrong with him, and their fight could now help 30 million American families who are searching for answers of their own.
Christina's path has been one of profound resilience and unwavering determination. As a mother who has faced the deepest loss with the passing of her son, Buddy, to a rare genetic disorder, NGLY1, and living with a rare disease herself, her life is a testament to the power of advocacy and love.
There's an act currently that's being pushed. It's called the Open Act. And I'm hoping that the Alabama delegation will support this act. It would speed up the process of getting these drugs approved for rare conditions like my son's.
Her voice has been pivotal in the halls of the Rare Disease Congressional Caucus, championing the Open Act and influencing the course of genetic sequencing research. Christina's efforts have significantly advanced precision medicine, transforming the landscape of rare disease diagnosis and treatment, and her work continues.
I'm grateful and really excited to hop on probably my favorite soapbox and talk to you today about genetic sequencing and its role in diagnosis. So this is my son, Bertrand, with the disclaimer that this journey is not unique to him. Rare disease affects 1 in 10 individuals in the US and around the world. There's over 7,000 of them, and actually because of sequencing and the success that we've seen, that number is growing.
Thank you, baby.
It's called I Love You Through and Through.
Alongside Christina in this journey of hope and change is her daughter, Victoria, a vibrant 12-year-old with a passion for competitive dancing. Victoria's spirit and creativity have been instrumental in their shared venture, Welcome to Co., a testament to inclusivity and accessibility.
I'm Victoria and I'm the junior co-founder. We started Welcome to Co because people like my older brother need it.
Together, Christina and Victoria have created a space where beauty and functionality converge, ensuring that everyone feels welcomed and cherished. Their commitment to Southern hospitality is not just a tradition, but a philosophy that infuses their work, creating a world where individuals are celebrated for their essence. Christina's advocacy, combined with Victoria's youthful energy and creativity, brings a unique and powerful dynamic to the fight against rare diseases. Their journey is a powerful reminder of the transformative impact of love, resilience, and innovation. The story of Christina and Victoria Might is more than a narrative of overcoming adversity. It is a beacon of hope and inspiration. It reminds us of the strength of family, the power of community, and the enduring spirit of those who strive to make a difference in the world of rare diseases.
Please join me in welcoming Christina and Victoria, who will now guide us through an evening of recognition and celebration.
Goodness. Thank you, Annie, and the entire team of Every Life. You guys know I love you, and a lot of people in this room. Good evening, rare disease warriors and esteemed guests. We are so honored to be here with you tonight. The holidays can be a really challenging time for so many of us. And I'm grateful for these awards because they give us something more to celebrate. They give us hope. And tonight, we celebrate the unsung heroes who amplify the voices of the rare disease community.
That's right, Mom. Tonight is all about honoring the incredible individuals and organizations who've transformed the world of rare diseases through their advocacy, passion, and legislative triumphs.
Yes, Victoria, I know you love to get dressed up. But this is an extra special occasion for it, don't you think?
Absolutely. Tonight, we're not just dressing up, we're showing up for the rare disease community, celebrating the victories, the progress, and the unwavering dedication of our advocates.
Also, joining us on stage tonight is Layla Waller. She'll be helping us present tonight's awards. And Layla lives with tuberous sclerosis, a rare genetic disease. But she volunteers here in DC with the Food and Friends, an organization that provides meals for people with serious illnesses. So welcome, Layla. We are so delighted to have you here with us tonight. Gosh. So now, let's move on to the moment we've all been waiting for. The announcement of the winners of the 12th Annual RareVoice Awards. So exciting. These individuals and organizations have shown exceptional dedication, passion, and impact in the rare disease community. No, that's me?
Oh yeah,
That's you. Okay, I can be it. Our first category is federal advocacy congressional staff. And these individuals have worked tirelessly behind the scenes in the halls of Congress. They're advocating for policies that make a significant impact in the lives of the rare disease community.
Hello, my name is Lucas Lamb, and I help support Congressman Swalwell's efforts in the rare disease space and lead his engagement as he is co-chair of the Congressional Personalized Medicine Caucus. The caucus is a forum that engages members and stakeholders in constructive dialogue about legislative and regulatory policies in the field of personalized medicine, cell and gene therapies, and genetic testing. I want to sincerely thank the Every Life Foundation and all the rare disease champions for their commitment to advocating for rare disease patients. You empower patients and their families, giving them a voice and platform to uplift the vital patient perspectives.
I'm privileged to serve Senator Bill Cassidy, who as a physician legislator is laser focused on supporting this patient population. In my role as staff director of the Senate Health, Education, Labor, and Pensions Committee, we are focused on what Congress needs to do to ensure that regulators can keep up with the pace of science, and that when there is a cure or treatment for a rare disease, that patients have access to it. Discoveries that never leave the lab or products that are priced too high for patients to access then may not, as well never have happened at all. This year, we also advanced the RARE Act, which would clarify the Orphan Drug Act in response to an adverse circuit court decision to preserve access to treatments for rare disease patients.
I was first introduced to the rare disease community through my former boss, the former chairman of the Ways and Means Committee, Kevin Brady. I was quickly introduced to the story of David Vetter. David suffered from severe combined immunodeficiency disease, or SCID. His mom, Carol Ann Demerit, worked tirelessly with Mr. Brady to advocate for policies that ensured that patients could get the treatment they need in the form of intravenous immunoglobulin treatments from the comfort of their home. This important work was the result of years of advocacy efforts from the rare disease community and dedication from Mr. Brady and Carol Ann.
So, for federal advocacy congressional staff, we have two exceptional winners. Amanda Lincoln from the Senate Health and Lucas Lim from Representative Salzwell's office. Your efforts to provide personalized medicine and access to treatments are so important for the rare disease community. Amanda cannot be here, unfortunately, so Riley Gabera will be accepting on her behalf.
Hello, I'm so glad to be surrounded by all the incredible advocates for the rare disease space. This is a very beautiful piece of art, and I'm really excited to take this home. I'm so honored to receive the Every Life Foundation's RareVoice Award, but this isn't about us. It's about all of us and our shared dedication to making a real difference for people with rare diseases. To all the patient advocates out there, you've been amazing at educating Congress and making sure they hear what really matters. Really want to give a special shout out to Cynthia Benz at the Personalized Medicine Coalition, Joe Cartner at the Muscular Dystrophy Association, and Christina Hartman at Bluebird Bio for always tirelessly keeping rare disease advocates in Congress on the right track. Getting this award is a nudge for us to keep going. We have so much more work to do, more stories to share, and more lives to improve. And it's all about making sure everyone in the rare disease community gets a voice and a seat at the table. Just something my boss, Congressman Eric Swalwell, is committed to, and that's why we continue to advocate for the Personalized Medicine Answers for Kids Today Act. Once again, big thanks for this honor, but even bigger thanks for all your support and hard work. Let's keep up the fight because every single voice can make a huge difference in the battle against rare diseases. Thank you.
Again, this is absolutely beautiful. Unfortunately, Amanda is unable to be with us tonight, and she sends her apologies. I work with Amanda for Senator Cassidy and the HELP Committee. She is beyond honored to work on these issues for Senator Cassidy at the committee and will continue to work with the rare disease community on these top priorities. We also wanted to thank everyone at the RDLA Foundation for all of their work that they do on this tremendously important topic. Once again, Amanda is extremely grateful to be honored tonight. Thank you.
Mom, it's amazing to see how Amanda and Lucas work their magic behind the scenes. They're like the choreographers of policymaking.
I guess so, yes, absolutely. They make a world of difference with their dedication.
Moving on to federal advocacy by a patient advocate organization. These advocates and organizations have shown extraordinary commitment and have been a voice for the rare disease community at the federal level.
Son Finn was diagnosed with a very aggressive and ultra-rare cancer called rhabdomyosarcoma when he was just 1.5 years old. Rhabdo ultimately ravaged Finn's body and took his life December 2nd of 2018. In order to be a better advocate for this community, all I want to do is bring about that change, both for Finn's legacy and for the lives of all the cancer patients who are fighting and will fight in the future.
I was born with a rare neuromuscular disease called spinal muscular atrophy and have lived my life from a wheelchair, slowly discovering the inequities that exist for people with disabilities. That's why today I work as a disability advocate in both my personal and professional life.
I think when you have a disability, advocacy becomes a part of your life. I draw strength from the community, knowing that there's not a battle that I face that somebody before me hasn't faced.
Hello, my name is Dr. Mark Smith, and I'm the director of the Friedman Center for Lymphedema Research and Treatment. It's difficult to see a cancer survivor come in and face an equally challenging prognosis in lymphedema, because untreated, lymphedema can lead to severe disability and even life-threatening infections or new malignancies. The mainstay of treatment is prevention, and this involves the use of compression garments. Unfortunately, many patients are unable to purchase compression garments because their insurance doesn't cover it. The Lymphedema Treatment Act is an essential piece of legislation that will ensure that patients will have insurance coverage for their lymphedema garments.
I'm Shelley Hoover, a U.S. Navy veteran, and I've been living with ALS for over 10 years. My advocacy at the federal level started with 6 consecutive years on Capitol Hill. My current advocacy work includes developing relationships with the House and Senate committees on Veterans Affairs to pass the Justice for ALS Veterans Act and within the Veterans Health Administration to demand equity and access to care for veterans living with ALS. ALS has taken my ability to speak, but it can't take my voice.
For federal advocacy, patient, or organization, the award goes to Mindy Henderson and Madison Lawson for their outstanding advocacy in the FAA reauthorization bill to improve the flying experience for passengers with disabilities. Congratulations.
Thank you so much. I have a few people right off the bat that I would like to acknowledge. I'd like to thank, of course, the Every Life Foundation for this honor. I'd also like to thank my colleagues at the Muscular Dystrophy Association's advocacy team, who could just as easily be up here accepting this award. And I'd also like to thank my co-nominee, Madison, whose heart, her wisdom, and her ability to compel people to listen to her inspires me more than she probably knows. I never saw myself as an advocate until I had the pleasure, the absolute honor, to interview the late Judy Heumann a couple of years ago, and she said to me that I was an advocate and that people would listen to me and that we could make change happen. And when someone like Judy Heumann says those things to you, you can't not go do those things. I have a long list of things that are important to me that I would like to be a part of moving the needle on and seeing change happen. But the business that we're in isn't about instant gratification. It's a long road, and I'm so proud to be a member of this community in this room tonight who's working so hard on things that they feel and believe in so deeply. The ability to work on accessible air travel this year and to prioritize that work has been incredibly thrilling. And while we're still a ways away from seeing wheelchair spots on airplanes, I've been in the front row to see some smaller changes that will add up to big change in the future, thanks to so many of the people in this room. Thank you so much.
Judy Heumann, as Mindy started talking about, a hero to many of us, described changes happening gradually and excruciatingly slow when people joined together. When Ryan Sheldon was filming this video, he told me, "Let me know if there's anything you don't want filmed or if anything is too invasive." I laughed and said, "Make sure you get every second so people know how miserable this is." I know this is the RareVoice Awards, but I can't describe to you how empowering it is to know that my story and experiences are not rare. I hate to inform you guys, I will never be half as brave as strangers at Target believe me to be when I'm out and about. Brave is an adjective to describe courage or a verb of endurance, so I've always wondered, how can you take one look at a person you don't know and describe them that way? All that taught me growing up is that non-disabled people know that barriers exist for disabled people that don't exist for them, and there's not really much they're doing about that. So if I want a more equitable world, I'll have to become a part of that change. I've had the privilege of never knowing a world without 504 and the ADA protecting my rights to be wherever I want to be. Yet I never learned about disability rights history in school or the laws that my disabled elders fought to be implemented in a way that the access I am guaranteed is a reality. Because of this, I believe the bravest parts of our stories are often the parts that nobody recognizes, the struggles we experience when most people aren't looking. Although this is the telling of my individual experience, I can't really call it my story. It's also the story of countless wheelchair users who have faced the same civil rights injustices that the FAA has failed to address for far too long. Thank you to Ryan Sheldon, my amazing friend Mindy Henderson, Strategic Elements, and the Muscular Dystrophy Association for reminding me of the power and vulnerability. We are just a few tiny grains in the collective sands of inevitable change. My hope is that one day flying as a wheelchair user doesn't require bravery and vulnerability. One day we won't have to convince lawmakers to care in order to have equal access to the world. One day young disabled people will never know a world where they didn't have the right to dignified air travel.
Wow. It's incredible to see patients and organizations, people like Mindy and Madison, using their voices to improve policy that helps the community in such a tangible way.
Yeah. Okay. Yeah, they're definitely a couple of advocacy rock stars.
They sure are. Next, let's honor the federal agency staff who have made significant contributions. There are two winners in this category: Philip P.J. Brooks from NCATS and Kelly Buckland from DOT. They've both shown long-standing dedication to improving accessibility for our community.
Hello, my name is PJ Brooks and I'm the Deputy Director of the Division of Rare Disease Research Innovation at NCATS, the National Center for Advancing Translational Sciences at NIH. In the past few years, we've seen FDA drug approvals for gene therapy for rare diseases. And in light of these developments, for many diseases, the limiting factor is not anymore the ability to develop an effective therapeutic. The problems are more practical and operational in terms of getting these treatments into patients as quickly and safely as possible. And a big part of the problem is that our whole system is based around the idea of developing one drug for one disease at a time. And with the support of NCATS leadership, I've been very privileged to work on programs such as the Platform Vector Gene Therapies, or PAVE-GT program, the Bespoke Gene Therapy Consortium, and the Somatic Cell Genome Editing Program, which is supported by the NIH Common Fund. And all of these programs, in one way or the other, are trying to streamline the process of bringing genetic therapies to patients.
My name is Kelly Buckland, and I am the Disability Policy Advisor here at the United States Department of Transportation. I was really motivated to get into disability rights when I received my spinal cord injury on July 26, 1970, and the ADA was passed on July 26, 1990, exactly 20 years later. So I've had the advantage of seeing what life was like for people with disabilities 20 years prior to the Americans with Disabilities Act, and then these many years since then, and learned that I could magnify my advocacy efforts by getting involved in legislative efforts to pass legislation that helped expand the rights of people with disabilities, including the Americans with Disabilities Act. The bipartisan infrastructure law really provides a once-in-a-generation opportunity for us to change the built environment, and we've been working hard on doing that since I was appointed here. Thank you all.
Congratulations to PJ Brooks and Kelly Buckland.
So PJ elected me to go first. Just really want to start off by thanking the Every Life Foundation for this award. It's a real honor to be here. Also want to thank my family and friends for being here during this, for the honor that I'm receiving. And really just want to give you a quick story about why I'm where I am. Like President Biden appointed me to this position in September of 2021. And it's the first time I've ever done a stint as a federal employee. Most of my advocacy's been in the private nonprofit sector, but I came here because I really wanted to make a difference. And the Department of Transportation has really been making a big difference because of the bipartisan infrastructure law. We're going to buy all new Amtrak trains. We are also changing air travel. So, Mindy, I don't think you're going to have to wait that long, actually. I think we're going to get a wheelchair spot on airplanes in the very near future. And before that, we are going to minimize the damage to chairs and the damage to people that's going on right now. We're planning to release a new rule mid-January that's going to affect a lot of that stuff. So we'll do some rollout around that. But so what I really want to leave by is thanking you again, and on behalf of the Secretary and all of my colleagues at DOT, I'm very honored to be here to accept the award. But I'm going to challenge you all to continue advocacy on behalf of accessible air travel. We are at a tipping point, and we can make a big difference in this next year. So give it all you have. Thank you very much.
Well, I also want to thank the committee and Every Life for this award. It's looking at some of the other people who'd won, it's really a tremendous honor, and I'm very grateful for that. There's a lot of people to thank, and if I tried to thank them all, it'd take way more than a minute, so I'll try not to do that. But basically, I was working in a research lab, and it was really meeting individuals, patients, and families with rare diseases that sort of changed the trajectory of my scientific career. But one particular person, Steve Groft, who was a director of the Office of Rare Diseases Research at NIH, kind of gave me the chance to actually change it, and for that I'm very grateful. I know Steve's here. This is an amazing time in the rare disease field. We've seen approvals for gene therapy, and actually just last week, the first approval for a gene editing therapy for sickle cell. But yeah. But in my view, really, that's just the tip of the iceberg, because with the technology we have, I mean, for almost any single gene disease, we could develop, at least in principle, an effective therapy. The limiting factors are the ability to deliver it to all the cells in the body, the ability to diagnose people at the appropriate age where we can deliver an effective treatment, and also a regulatory and drug development system that isn't really set up to do one disease, that's set up to do one disease at a time, and isn't really set up to deal with therapeutic platforms like gene therapy and gene editing. And I said a lot of that stuff in the recording, so I won't repeat it, but I think that's what really excites me, is the opportunity to be at NIH, and particularly to be at NCATS, the National Center for Advancing Translational Sciences, and with the support of our director, Joni Rutter, who's here, to be able to work on these big trans-NIH programs to address all those issues. So I feel very lucky to have the job I have, and also very fortunate and appreciative for this award. So thank you very much.
PJ and Kelly remind us that one person's efforts can bring about meaningful change.
That's right. Every voice counts in our fight against rare diseases. And speaking of every voice, shameless plug, in just a couple of months, hundreds of advocates will gather for Rare Disease Week on Capitol Hill here in Washington, D.C. All right? And let me tell you, and I'm sure many of us here in this room can attest, it is hands down the favorite week of the year. Here's a sneak preview of what you can expect. I sincerely hope you will be able to join us February 25th through 28th for Rare Disease Week. Not only is it just so much fun to gather with each other, but it also provides a huge payoff for the community.
That sounds like an awesome week, Mom. Really. Now, back to the awards. In the State Advocacy by State Legislator category, we have a group of dedicated legislators who've been fighting hard on behalf of our community.
Despite all of the technology we have and the medical treatment we have, far too many people are denied the care they need. I worked on issues related to rare disorders, working to ensure that the Rare Disease Advisory Council in Minnesota had the independence it needed to advocate for the people it served. The legislation we passed helps with that, and we're committed in Minnesota to continuing to put policies in place that make the healthcare system work better for everyone.
What inspires me are my own children. And I think about them when I'm hearing from a family that their child is suffering from a rare disease and they don't know where to turn. Just because the disease is rare and not a lot of people have it doesn't make it any less devastating for that child or for that family. That's why I'm so proud to be able to raise their voice, to take it here to the halls of the Pennsylvania legislature, and to really advocate for change in this area.
One of the most core principles of our republic is that we have our vote. Well, if you're sight impaired, you have to depend on someone else to mark your ballot for you. The way I became aware of this issue was a young lady in my district named Leah. Leah is blind and paraplegic, and she depends on her parents in order to mark her ballot. So by providing this system to be able to electronically receive it, hear her ballot, and be able to check it herself, then print it and send it in like every other Oklahoman that does an absentee ballot, she's now able to verify that most constitutional principle.
At the start of my career years ago, I worked in the field of HIV and AIDS, which is not a rare disease. It's actually quite common. And through working with people living with HIV, I learned so much about how many things affect our health and our access to healthcare outside of medical care. And people with rare diseases have all of those challenges in addition to trying to figure out what in the heck disease do you have? How does it manifest? How is it different from everybody? How do you get treatment? We know that diseases that are only a few folks that have them have really expensive drugs to treat them, and we shouldn't take that out on them.
Our State Advocacy State Legislator Award winner is Representative Liz Ryer from Minnesota, who has championed the Minnesota RDAC bill and out-of-network access bill. Representative Meyer wasn't able to be here tonight, but she wanted to share a few words. Let's roll the video.
Hello, I'm Minnesota State Representative Liz Ryer. My thanks to the Every Life Foundation for honoring me with the RareVoice Award. I wish I could be there in person. Healthcare is a human right, yet access to care is often denied to people who need it most. My work on behalf of the rare disease community has been some of the most meaningful of my career and reflects one of my top priorities as a legislator. I'm very proud of the bipartisan network access bill I authored and that we passed in Minnesota this year. It dramatically opens access to care for rare and hard to diagnose conditions. It removes burdens from patients and their families, will preserve quality of life, and will save lives. Thank you to my colleagues on both sides of the aisle and stakeholders, including health plans and healthcare providers, who helped make this a better bill. My greatest thanks go to Erica Barnes, the Minnesota Rare Disease Advisory Council, and all of the patients and families in the rare disease community for your staunch advocacy.
Thanks to Representative Meyer for being our champion. State legislators play such a crucial role in blazing trails and removing hurdles for the rare disease community. They're like the superheroes of policymaking.
Indeed. Next up, we have our patient advocate or organization nominees at the state level. Their advocacy ranges from newborn screening to rare disease advisory councils and beyond.
Life magazine wrote an article in 1986 about me and my mom. The article kind of was the first publication that launched Alzheimer's disease into the national spotlight. So over the last 40 years, I've spent quite a bit of time looking at policy and trying to help organizations and entities develop policy.
We have fought to bring together stakeholders from across the rare disease ecosystem in Indiana to form the Indiana Rare Coalition and organized a successful effort to bring a rare disease advisory council to our state.
We spent countless hours calling and emailing representatives and senators to advocate for the passage of HB 1201, a bill that establishes a rare disease advisory council in Indiana.
We are proud to say that Indiana's Rare Disease Advisory Council just met for the very first time, a monumental occasion for the inclusion of rare disease patient interests in state policy going forward.
I joined the Texas Rare Alliance team to help advocate on behalf of others like me who are living with a rare disease or caring for someone with a rare disease. One of our top priorities for this legislative session was the expansion of newborn screening to bring it into current alignment with the RUSP. We are deeply humbled and grateful to be recognized for the work that we did this year.
My journey into advocacy began when I faced the daunting task of navigating a severely dysfunctional and fragmented medical system. My advocacy efforts have resulted in the passage of Senate Bill 221 that officially creates a new provider category specifically tailored to clinics dedicated to treating children with cancer and rare diseases.
I was inspired to become a rare disease advocate because, first of all, many people, even those who have sickle cell, are not aware that sickle cell is a rare disease. Sickle cell patients only account for 100,000 people, and I wanted to lend my voice to this population that we can do great things if we band together.
In the State Advocacy Patient or Organization category, the award goes to Annette Logan Parker from Cures for the Kids Foundation for her advocacy in establishing a new billing category to provide services to children with cancer and rare diseases in Nevada. Congratulations, Annette.
Wow, what a beautiful piece of art here. This is lovely. If everybody didn't get a chance to see these are amazing. So good evening, ladies and gentlemen. I'm deeply honored to accept this prestigious award. It's an award that carries significant meaning to me because it represents the collective effort that lots of people make. Everybody here tonight and lots of people in Nevada have worked hard to make this happen. As I look around the room this evening and I see the extraordinary individuals that were nominated alongside me, I'm truly humbled. This award is a testament to the tireless advocacy, unwavering commitment, and the relentless pursuit for people of Nevada living with a rare disease. It recognizes those who have taken risks, fostered cooperation, achieved successes, and more importantly, influenced policies that improve the lives of people with rare diseases as well as the providers who care for them. I humbly accept this award on behalf of the entire Cure for the Kids Foundation team and all of the lawmakers in Nevada. We've all participated to it in our unique way, and this journey, which is the ultimate success of the legislation that is done in Nevada, a state that is not known for progressive health care. I want to express my gratitude to my colleagues, my friends, and most importantly, to my husband and my family. They have supported me throughout this remarkable journey, and they were the driving force behind me being able to get this legislation over the finish line. So let us all continue to be the game changers and the passionate advocates that the RareVoice Foundation recognized this evening. Together, we have the power to make a difference in the lives of patients with rare diseases. Thank you. It's an honor.
It's amazing to see how these champions can change lives for the better, especially for kids.
That's right, Victoria. Advocacy can move mountains.
Okay, this one is my personal favorite. The advocacy by youth or teenager category is always so inspiring. These nominees have shown incredible dedication and passion in advocating for various causes within the rare disease community.
At a young age, I was diagnosed with hereditary angioedema with normal C1. After receiving my diagnosis, I began to feel incredibly lonely and socially isolated. Through my advocacy work, I hope to open the doors to a society where young people with rare diseases can dream without boundaries and aspire without hesitation.
I have a rare genetic disorder called rheumatoid acidemia aciduria type 1. I was diagnosed with this disorder by the newborn screening in Mississippi, which saved my life. I hope by sharing my journey with living with a rare disease, I will inspire others to speak up for the needs of our rare community.
My mom was diagnosed with a neurological pain disorder called complex regional pain syndrome. The disease is incurable and lacks any FDA-approved treatments. As more legislation is proposed, I hope that I can advocate on behalf of the many rare disease warriors like my mom who would benefit from drug repurposing and continued research. My mom's persistence has proved to me that anything is possible if I use my voice and my creativity.
Friedreich's ataxia has taken away my ability to walk, and it's made simple things a huge challenge for me. So I wanted to do something to fight back. Through my advocacy journey, I've learned that when compassionate legislators get to work with an engaged community, great things can happen.
I am a rare disease advocate for sickle cell disease. As an advocate, I've been able to form connections with legislators and policymakers to work towards bettering health reform as we know it today. I'm so proud of the work I've gotten to do thus far within the sickle cell community, and I hope to continue that work throughout the trajectory of my life.
I suffer from a rare genetic disorder called Swatchman-Diamond syndrome, which causes issues with the pancreas and bone marrow failure. What really advanced my advocacy journey is being able to learn about the RDLA and being able to talk to members of Congress on how they could make our lives easier just a little bit. Dealing with a rare disease can be devastating, but having these opportunities to change our healthcare system leaves me with hope for the future.
I have a rare disease called Stickler syndrome with hypermobility. It is a connective tissue disorder that has no cure. This has made me want to advocate for myself and others with rare diseases. So that is what I started to do beginning a year ago. An upcoming bill titled Accelerating Kids Access to Care Act will allow kids with rare diseases like me to be able to receive medical care across state lines. This has become a critical issue for many of us.
The winner in the advocacy by youth or teenager is Samantha Rose. Your extraordinary contributions and relentless advocacy on behalf of your mom and so many other warriors are truly inspiring. Congratulations, Samantha.
Wow, first of all, thank you so much for this incredible RareVoice Award, and I want to say more than anything, congratulations to everyone here tonight on such amazing work over the past year. And as I alluded to in my video, all of my motivation really comes from my mom, who 10 years ago, when I was only 5 years old, was diagnosed with a rare neurological pain disorder called complex regional pain syndrome. It's ranked as the most painful disease known to medical science and unfortunately is incurable. And I, like many of you here tonight, refuse to sit back and watch my mom suffer. I'm not one to take no for an answer. Trust me, my parents have had to live with me for the past 16 years. Put plainly, I'm a complete biology nerd, first of all. And however, as much as I love science, I realize that progress cannot solely start from science labs and major hospitals. The integration of science and legislation is crucial. CRPS is one of the many rare diseases that would benefit from drug repurposing efforts and continued scientific research. Expediting FDA approvals and retaining access to telehealth also is extremely important. And I couldn't be here tonight without the unconditional support that I've received throughout my journey. I'd first like to thank my fellow advocates in my New Jersey District 11 for being role models in me and guiding me throughout this journey. I'm especially grateful for my representative, Mikey Sherrill, and absolutely everyone at her office for their continued kindness and willingness to create impactful change for our community. To my teachers at school, thank you for teaching me never to shy away from a good challenge. My sincere gratitude also goes to Jerry Krasner, Jim Broach, and the rest of the RSDSA organization for CRPS for believing in me despite my young age. To my dad, thank you for teaching me not to be so hard on myself. All of your work behind the scenes truly does not go unnoticed. Thank you to my grandparents and my aunt as well. And most of all, I want to thank my mom, who unfortunately was not able to make the drive down from New Jersey today, but is with us in spirit. You're a warrior, and I'll be lucky if I have 1 ounce of the strength that you have when I'm older. One final note, just as a side note, if you're looking for something to watch over the holidays, I highly suggest watching the Netflix documentary Take Care of Maya, which I hope can teach you a bit more about the struggles of CRPS patients like my mom. It may be an uphill battle, but we rare disease patients and advocates truly have the power to reach new heights. There's always power in numbers. Thank you so much.
Thank you. Wow, I'm just blown away. I mean, I know y'all are too. I mean, the passion and drive of these young advocates, that's just truly inspiring. They're the future of our community.
I'm also I'm so impressed. They are like rising stars, lighting the way forward.
Yeah, they really are. Well, next, the Diversity Empowerment Award goes to an individual whose contributions have enriched the diversity and inclusivity of the rare disease community.
I was inspired to become a rare disease patient advocate and to start Rare and Black after a complicated 45-year medical odyssey where I was eventually diagnosed at the age of 45 with my first rare condition. And so at Rare and Black, we try to change the narrative in every aspect of advocacy to make sure that they don't leave the Black patient, voice, or caregiver out of the conversation. It is imperative that all of the members of our society, no matter what race you are, that you're part of the conversation so you can be part of the solution.
I decided to become a rare disease advocate when I was diagnosed with several rare and rarely diagnosed conditions in late 2021. My main diagnosis being classical Ehlers-Danlos syndrome. And I want to take advocacy skills that I learned in broader disability advocacy and in LGBTQIA+ spaces to the rare disease space. And so part of my advocacy is being open about what it looks like as a young adult, as someone who is diagnosed really late, as a trans person with rare diseases.
What inspired me to be an advocate was being told that my son wasn't worth the medical resources. It's an entire healthcare system that was looking at his rare diagnosis and not him as a person. And so I continue to be an advocate for him. We use our lived experiences to amplify legislation that we believe can create better health outcomes for families like ours.
My career has focused on speaking up for those who cannot speak up for themselves and for improving the lives of underserved individuals. I have been so moved by the passion and collaborative spirit of the rare disease community. As a leader for rare diseases, I have personally witnessed how we can lift each other up and bring light to those in need. It has been my honor to bring about necessary change to address disparities and improve the lives of all impacted by rare disease.
And the Diversity Empowerment Award goes to Carter Hemian. Their commitment to advocating for diversity and inclusion in the rare disease community is nothing short of inspiring. Carter could not be with us tonight, so we will be accepting the award on their behalf.
Diversity is what makes our community so strong and vibrant.
It sure does, Vi. It's the mosaic of our community that makes us so unique and powerful.
And last, but definitely not least, we applaud the nominees for the Artist to Advocate Award, where nominees have used their unique platforms to advocate and make a difference in the rare disease community.
What inspired me to be a rare disease advocate was how much I was able to connect to the personal, private experiences of others simply by being vulnerable and telling my own story through my own art. The exposure my art provided has allowed me to connect with and start working with a number of patient-focused clinical research organizations to impact change on how clinical trials are designed. I met with senators and House reps to press in the same area for support of the Benefit Act. This legislative experience, which was my first, has taught me that Hill advocacy is not a sprint, it's a marathon. Together, we can do it.
Advocacy was really a way that I could use everything that I've gone through in my life and the things that I continue to struggle with. I have really been focusing on my advocacy at the state level and at the local level. Specifically here in my home state of Massachusetts, I have actually been able to use my Rare Artist piece in these meetings to sort of have a way to broach the subject of my condition, and several of my representatives now have their own copy of my piece that I hope is a little reminder of the rare disease community as they're making these decisions and voting on these pieces of legislation that really have the opportunity to help our community.
When I was first diagnosed with neuromyelitis optica, it was a big adjustment. I want to help other patients improve the quality of their lives. When I was first diagnosed, I felt helpless, unable to control all of the obstacles and inconveniences that were thrown my way. Now, those frustrations serve as my fuel to make a difference in the lives of other patients.
My mom was diagnosed with an arteriovenous malformation 2 years ago. I wanted to help spread awareness about this disease, so I joined the Aneurysm and AVM Foundation, or TAF. I've learned in the past year that sharing my experiences in ways that are meaningful to you, like I did with art with legislators, has made a monumental impact on advocating, and especially because they remember these stories as they resonate with you and them. All these experiences and opportunities have really helped me come a long way, and I'm so excited to see what more I can do in the future.
Announcing the awardee for this category, please welcome WCG Clinical, the exclusive sponsor of the Artist to Advocate Award.
As the father and grandfather of 2 kids a generation apart with rare diseases, I've seen the difference a generation can make in bringing better medicine and reducing the diagnostic odyssey. That work, that progress, is thanks in no small part to the work of the Every Life Foundation for Rare Diseases and many collaborating advocates. We have a long way to go and we need more advocates. And in that vein, the company I work for, WCG, is pleased to sponsor the Artist to Advocate Award that recognizes advocates who use their art for federal or state legislation. We are very excited to announce tonight that the Artist to Advocate Award goes to Nell Choi. Congratulations, Nell.
Congratulations, Nell. We are so impressed with your creativity and drive, using your frustration as fuel to make a difference for others in the rare disease community.
First of all, I have to say that I feel like I've never been surrounded by so many cool people before. 90 seconds isn't a lot of time to express all of my gratitude, but Mom, Dad, and Jake, thank you so much for supporting me through this rare roller coaster, and also for just brightening my day with those really funny cat memes you always send. To my art teacher, Miss Campbell, I see you. Thank you for helping me find beauty in the broken pieces. You inspire me to keep creating, keep loving, and keep learning. Next, I cannot help but recognize my fellow artist advocates. Actually, can we just give a hand for Wes, Laura, and Anya? Wes, I know you're not here tonight, but I'll never forget how you wore that t-shirt with your rare artist piece during Rare Disease Week. I swear, man, you gotta start selling those on eBay. Anya, meeting another teen who understands the rare experience has been life-changing, and I'm so lucky to call you my friend. And Laura, I've never laughed more than I did on that long bus ride from Rare Family Day. You never fail to make me smile. And last but certainly not least, there's one special person I cannot go without thanking. Stephanie, there are no words to describe my gratitude. Thank you for making me feel more seen and loved than ever before. You are my superhero. Thank you.
Well, wow. What an unforgettable evening we've had. Each story we heard tonight and every award we presented just reminds us of the incredible strength and spirit of our rare disease community.
This has been so much fun. It's been an honor to be part of this celebration, recognizing the heroes who work so hard to make a difference.
Yes. And as we conclude tonight's ceremony, we want to extend a heartfelt thank you to everyone who joined us tonight. Your support fuels the mission of the Every Life Foundation for Rare Diseases and amplifies the voice of the rare disease community.
Mom, let's carry the inspiration from tonight with us. I'm excited to keep advocating, keep fighting, and keep making our voices heard.
Absolutely, V. Never stop. Let's keep this momentum going. I mean, how could you not after all of that? Let's continue to celebrate our achievements, support one another, and look forward to a future where every voice in the rare disease community is heard and valued. Safe travels home, and we look forward to seeing you again next year and at Rare Disease Week.